An important stage in the Hunter syndrome journey for patients and families comes after they receive a diagnosis, when they must consider what to expect in terms of managing the symptoms of the condition. Hunter syndrome can affect many different parts of the body and therefore requires complex physical management. The management of these symptoms requires a team of specialists. We will explore some of the key specialists who make up this multidisciplinary team. However, there are many others who can also be involved. These include specialist nurses, anesthesiologists, ophthalmologists, physical therapists, occupational therapists, and speech therapists. One of the core members of the multidisciplinary team for Hunter syndrome patients is their pediatrician. A pediatrician or family practice physician can act as a coordinator of the team and be a primary point of medical contact for families. They will often be the ones to evaluate the overall symptoms experienced by the patient. Following this, they will then be able to refer the patient to those with more specialized knowledge on certain symptoms. Pediatricians also help manage other problems that affect children, such as developmental disorders and behavioral, emotional, and social problems. Some of the most common symptoms experienced by patients with Hunter syndrome are related to their ears, nose, and throat. This makes an ENT specialist a key member of the team. Some of the most common symptoms ENT specialists treat in cases of Hunter syndrome include ear infections and hearing loss. Patients with Hunter syndrome tend to visit an ENT specialist every 6 to 12 months for hearing tests, depending on the progression of their symptoms. The respiratory system is another key bodily system that is often affected by Hunter syndrome. A pulmonologist will therefore often be involved in the management of Hunter syndrome to treat symptoms such as airway obstruction and sleep apnea. Patients with Hunter syndrome may also visit a pulmonologist for breathing tests or overnight sleep studies if they experience sleep apnea. Nearly all patients with Hunter syndrome will experience symptoms related to their heart and blood vessels, making a cardiologist another key member of the team. Common Hunter patient symptoms requiring a cardiologist include heart valve disease, weakened heart muscles, irregular heart rhythms, and high blood pressure. Most Hunter patients will exhibit at least one cardiovascular sign or symptom by the time they reach their second decade of life, with some experiencing cardiac disease as early as 5 years of age. Among other treatments, a cardiologist can treat patients experiencing high blood pressure with antihypertensive medications. A gastroenterologist has special training in diagnosing and treating issues relating to the digestive system. In Hunter syndrome, some of these issues may include recurrent watery diarrhea or constipation. A rheumatologist has special training in diagnosing and treating issues that affect the muscles, bones, joints, ligaments, and tendons. In Hunter syndrome patients, some of the most common symptoms a rheumatologist can treat include joint stiffness and a limited range of motion. As part of this, a rheumatologist may perform X-rays and range of motion tests. Neurologists generally will only be involved in the management of patients with a more severe form of Hunter syndrome, in which there is neurological involvement. Some of the symptoms neurologists may treat in these patients include seizures, carpal tunnel syndrome, and communicating hydrocephalus. A neurologist may also evaluate the patient's spine and perform behavioral and cognitive tests, as well as hand and nerve tests. By the time they turn 3 years of age, around 50% of patients with Hunter syndrome have undergone hernia repair surgery, and 47% have had their adenoids removed. By 4 years of age, 36% of patients have had a tonsillectomy. Pediatric surgeons can therefore play a vital role in the multidisciplinary team as the specialists who will perform these surgeries. Other conditions that can be treated surgically include carpal tunnel syndrome, scoliosis or curvature of the spine, and joint contractures or limited joint movement. This may seem like a long list of specialists, which can feel a little daunting to those who have recently received a diagnosis. However, it's important to remember that they are there to help. Hunter syndrome is a complex condition, and each patient's experience of it will be unique to them. Having a personalized multidisciplinary team, which will often include the specialists explored in this video, can provide patients and their families with additional tailored support during this stage of their journey. They will be there to work alongside families and caregivers to care for the patients and can help to alleviate some of the management burdens they experience. It is vital to raise awareness of this rare disease in order to help families and caregivers get the help they need from the right specialists as early as possible. There are a number of resources out there dedicated to raising awareness and providing more information about Hunter syndrome. Visit hunterpatients.com today to learn more and help those on this journey. Talk to your doctor if you're concerned about symptoms or have any other questions about Hunter syndrome.